and welcome to A Moment of Science, Please. I am one of your hosts, Ellis.
And I'm your second host, Aghia.
So today we'd like to welcome Dr. Massaquoi, who is an assistant professor in the Health Education and Promotion with the Department of Health and Society at the University of Toronto Scarborough campus. Welcome, Natisha.
Thank you so much. Thank you.
So we'd like to start off by asking you if you could please introduce yourself and tell us a little bit more about your background in education.
So I'm Dr. Massaquoi, and as you said, I'm very new, I started in July, assistant professor with the Department of Health and Society at UTSC. My background, my PhD is in sociology and equity studies, and it's with the Department of Social Justice Education at OISE at U of T. And so my research is looking at phenomena as they happen, and studying that phenomenon. The phenomena that I look at specifically is anti-Black racism and the impact that it has on Black communities in Canada. And I look at it from particularly the health perspective. My master's is in social work, also from U of T, and my bachelor is in psychology from Western University. So that's my educational history.
Wow, I think your background is actually very unique and different. So it's always very good to have different people for our audience. And well, this brings me to our next question. I wanted to ask, how did you choose your area of research, I guess, in health equity specifically? What led you towards this path?
Well, I should say before coming to UTSC in July, I spent 30 years working in the healthcare system in Ontario. So I consider that part of my education as well. And, how did I come to look at health equity specifically? It's very, very easy. When I finished my master's degree, my first job was a job that I had to create. It's one where a group of us came together and we developed an organization called Africans in Partnership Against AIDS. At that time in the 90s, the HIV crisis had really taken off in continental African communities in Canada. But there wasn't any organization that was able to provide services, linguistic services, culturally appropriate services, period. There was so much stigma attached to being HIV positive. And a lot of people were blaming African people for bringing HIV to Canada. So we started an organization called Africans in Partnership Against AIDS. And I was the staff of that organization, staff of one. And what happened was every single client that came through the door for service died within a year. I lost my entire caseload. Like anybody who walked through that door on any day, I knew was not going to survive the year. We didn't have access to HIV medication that we have today. And people weren't dying simply because they were HIV positive. It was just a lack of access to services, the stigma attached to it, lack of physicians that would even treat our clients. We had no specialists who were working with our clients. Simple things like lack of stable housing. If you become ill, not having insurance to get services. I mean, we can go on and on and on down the list of the social determinants of health. And that's what people were dying from. So when you lose your entire caseload as a social worker, you realize that you have to do something differently, that we have to look at changes in our healthcare system that are not going to disadvantage particular populations of people because of their identity or because of a particular illness that they have. So that's where that work and focus has come from. And it has been for over 20 years now. From there, I went on to collaborate with another group, and we developed an organization called Women's Health in Women's Hands, which is a community health center located in downtown Toronto. And I was the executive director there for 22 years. And the whole design of that center is specifically to serve Black and racialized women Our management team, our board, 95% of our staff are Black and racialized women, serving Black and racialized women, and designing healthcare programs, services, and research specifically to understand what our healthcare needs are. And so that is my work in health equity. It's not just about identifying what the problems are. My work involves developing organizations and developing programs and services specifically to address health equity. And my focus has been on Black and racialized women.
That's amazing how you've pioneered so many initiatives and change, not just to advocate, but also to initiate the change in the community. So, well, it's like what you've talked about, and also from some of your previous talks, you discussed how there's existing history and inequity and the lack of opportunities for racialized communities like the Black community. So could you describe some of the experiences or summarize some of your potential experiences that you've had to really see and feel the impact of these lack of opportunities?
So the big one that you can see, right, if I look at Black people in particular, is how few of us actually are in health sciences programs, right? It's very, very obvious. It's very stark. If we think about our population nationally, we make up 4.3% of the population of Canada. I don't think there's any healthcare field where you will see service providers that are Black at a rate of 4.3%. For example, there are only maybe 2.2% of all physicians in Canada identify as Black. You can walk into any of our hospitals today in Toronto, for example, there are 12 TAS and teaching hospitals. And the ratio of Black physicians would be 4 to 1,200, 5 to 900. And so it's very stark. I'm using medical professionals, physicians, but we can look at it in nursing. We can look at it in all of the healthcare fields. And then it gets worse the higher you rise in those professions in terms of senior leadership, management, who's sitting at the table in terms of major decision making. So that's the biggest stark reality that you're going to see. And, it goes right down to who's entering undergrad, who's moving from undergrad into grad school, right? Who's moving from undergrad into professional programs, and what are the barriers that exist? We just saw with our university at U of T the largest cohort of Black medical students in the history of Canada, 24. Right? That's in the history of Canada in this day and age, only 24. And that says a lot. That says a lot about the barriers that exist in our system in terms of access for Black people. So that's just one area to take a look at. And there are many more that we could think about as well.
Mm-hmm, for sure. And in terms of barriers, what would you say are some common barriers to access?
You have to go back historically. And a lot of people don't understand the historical barriers that have been put in place. And, I'm talking about Black communities in particular. In 1911, and this, sorry to take us back, but it's important because then you'll understand the current situation. In 1911, our prime minister at the time tabled an order in Parliament to ban Black migration to Canada. Sir Wilfrid Laurier was the prime minister at the time. There was a fear that after slavery had ended, all these free slaves are going to cross that border from the US and come into Canada. So there was an enormous amount of money and effort put into promoting this idea that Black people are not suitable. The language was the Negro race is not suitable for the conditions and climate of Canada. What happened is that all of our institutions followed suit and started banning Black people from accessing. The greatest example that we have, because they're very honest about it, is Queen's University. So they then banned all Black students from school. There were 15 Black medical students registered at Queen's University at the time. They were all expelled. And then if you follow their history, you see that they all went into, the jobs that were available to Black men at that time, which are laborers, railway porters, custodians, those types of jobs. We still haven't recovered from that. Queens didn't lift the ban of Black students until 1965, and some of our universities didn't lift the banning of Black students from accessing education almost up until 1970. So you have already a history where we don't acknowledge it, right? We don't change that culture, right? What are the conditions that allowed universities to not accept Black students? And we still operate that way. Our systems are still operating that way, because unless you disrupt it, change it, remove all of the policies and rules that are in place that disadvantage particular students based on race, you're not going to change it. The other thing that you have to understand is that our Canadian education system, if I ask any one of you, what did you learn in school, if you went to school in Canada, about the contributions that Black people have made to Canada? You're going to tell me nothing, right? We've learned nothing. You can't name someone who has contributed significantly to the development of this country that we call Canada, this colonized space. When you are educated that Black people aren't contributors, right? There's no alarm that goes off when you enter a space and you don't see Black people, right? Because you've already been trained psychologically to believe they're not valuable, they don't contribute, right? There's nothing wrong with their absence, right? That's the psychology that we have to disrupt. We have to really sit down and think about, there are barriers in terms of racist individuals not selecting someone because of their race, but we also have a systemic psychological understanding that it's okay for Black people to not be in spaces, and it's okay for us to make sure that they don't succeed in spaces.
Yes, for sure. Hearing that history, it's very evident how there's a lack of just acknowledgement of the population and its contributions. Would you say that there are current actions being taken either provincially, institutionally, or as a country to improve the situation?
I think COVID has made us really sit down and take a look at this. The biggest thing that we have to look at, one of the biggest barriers to addressing discrimination, any form of oppression, is the ability to document it, count it, and acknowledge it. We don't collect race-based data in Canada, right? So we do not know who's where. We do not know if they're having a different experience from other people because we don't acknowledge that we need to collect race-based data. COVID forced us to do that. It really did. And when we did collect race-based data for COVID, what did we find? Let's look at Toronto. 83% of all people who contracted COVID in Toronto were racialized. Well, 83%. Only 17% of people who contracted COVID identified as white. And Black populations had the highest rates of COVID at 23% and 24% of a hospitalization rate. So, one of the things that is changing is the collection of race-based data. Right? If you don't measure it, you can't count it. So it's very important to understand that is a crucial component to change. I think the other thing that is changing are things like cohort hires, for example. U of T is doing enormous amount of what we call Black cohort hiring. So hiring groups of Black professors. Some people think that is not the way to go, that it's tokenism. What you're actually doing is compensating for the years that Black people have not been able to access your institution. So you have to catch up, or you have to catch up. So you have to do enormous amounts of hiring of Black people, enormous amounts of recruitment of Black students to compensate for 30, 40 years of banning them from participation. So, those are some of the things that are happening. We're also seeing more research dollars going towards looking at health issues that are very specific to Black and racialized communities and Indigenous populations as well. And those are small steps, but we have to consistently keep doing those things to actually help us erase the impact of historical systemic racism that exists in Canada.
Thank you so much for bringing up the topic of, collecting racialized data, I guess, as a lot of our audience are also supposed to be aspiring researchers. So thank you for bringing that up. I guess I have a follow-up question, kind of, that might be out of my own curiosity. So we talked about anti-Black racism, or maybe racism as like racism in general. But, when we were investigating your research topics for this episode, I found out that you also are interested in Black feminist thought and African queer theory. So this personally made me think of the topic of intersectionality when talking about racism. So I guess in your opinion, how important it is to consider intersectionality when you're discussing oppression?
Absolutely, absolutely. So in the vein of Kimberly Crenshaw, who is the person who originated the concept of intersectionality, a Black legal theorist from the States, it's the understanding that, I don't just walk into the room as a Black woman. There are many other identities that come with that, my sexual orientation, my religion, my socioeconomic status, all of those things. So I walk into a space as a whole person. And so, even though my focus may look at systemic anti-Black racism, it plays out very differently. Right? Systemic racism plays out very differently dependent on our identities. Right? So when I talk about anti-Black racism, I'm talking about the experience that a Black person might have. Anti-Black racism impacting someone who identifies as female is going to look very different. If I look at racism and how it impacts Asian people today with COVID, right? Anti-Asian racism, right? It's so extreme. You can walk on the street and someone could just beat you. Right? We've watched so many videos of that, and that's what anti-Asian racism looks like today. And then, Islamophobia, like we can go through, right, what those different forms look like. But when I look at Black feminist thought, for example, it's looking at what that experience looks like when it's gendered. So if I am a Black Muslim woman wearing the hijab, right, the attack that I might experience of someone trying to rip that hijab off on the subway, which is something we hear about all the time in Toronto, right, is about my intersectionality. Right? So it means that the oppression that you experience will differ. Right? So it's very important we understand that people are having different experiences with oppression based on the number of intersectional identities that they walk into a room with.
For sure. And that's such an interesting topic of research. And from everything that you've said, I've noticed that there's a lot of research topics. So if you could name one topic of research that you currently do that you think is super important, but often neglected or overlooked, what would you say that would be? And why do you think it's important to this field?
Yeah, the thing that I'm looking at right now, and it's not that it's more important than the others, it's just what I'm looking at right now because of the time that we're in. I'm looking at health disparities that are experienced by Black communities. So COVID, for example, it's very evident. We had the highest rates of COVID. We have to look at why that is the case. I'm also very much, as you said, my eye-opening moment was the moment I realized that no matter what HIV positive client walked through my doors, I couldn't do anything to save them in that moment. And so I still do a lot of research on HIV. Black women have the highest rates of new HIV infections in the province. We're almost at 70% of all new cases of HIV for Toronto are Black women. So we are not responding to disparities that Black communities experience. 90% of all babies born HIV positive at Sick Kids Hospital were Black. And so when we have a society that doesn't go, oh my God, we have to do something, right? It goes back to what I explained, how we're conditioned to not respond to Black trauma, Black absence, right? Or even respond to Black excellence in that respect. But we're definitely not conditioned to respond to Black disparities. So that is some of the research that I'm doing now, to look at solutions, right? How do we develop programs and services to address health disparities? And how do I train health providers to become alerted and respond appropriately to health disparities?
Thank you so much for sharing that. And I guess on that note, I just want to ask you, I know that you talked about the research that you're currently doing, but if there was a topic that you haven't researched or looked into currently, is there anything that you want to research in the future, any topic that you're looking forward to studying in the future?
Yeah, one of the things this is just personal passion, is just young women, young Black women and racialized women in health leadership, right? Like, how do we move more women into leadership positions, right? I want to see Black and racialized and Indigenous women as hospital CEOs. How do we get more of us on boards? How do we get into decision-making positions? So I want to take a look at, how do we develop mentorship programs that are going to actually create this pool of, very vibrant, intelligent, innovative young women into these leadership roles? Because I think that's a deficit that our system has, our healthcare system has right now. It's imbalanced, especially gender imbalanced still in terms of leadership.
For sure.
If we have time, I just wanted to bring something up, because you talked about seeing female CEOs. Because I've had different volunteer and positions in different hospitals, and I remember one time I was walking past this hall that had the picture of all the CEOs on the wall, and I looked at it, and it was all white men, and I thought, well, as a women of color myself, I was like, well, then what does it say about me? Do I belong here? And so I certainly think that that's a very interesting topic for research in future, for sure.
Yeah, your research has to, I believe this, it's not everyone thinks this, but your research has to provide advocacy, right? It has to provide the ammunition to change things. And right now, no one is actually even talking about the lack of racialized women in positions of leadership in the healthcare system. And we have to address it. We have to address it.
For sure. And I feel like even in this field, it's hard to find information because no one is talking about it. So even if we wanted to know, we don't have resources to know. So I think it's amazing that you're doing research in this area. And so leading to that, do you have any tips for students who wants to pursue this area or perhaps want to learn more into this kind of research?
I think, sometimes students are nervous to come and talk to you, or they're very shy. And I'm like, this is your opportunity, right? This is probably the most access you're going to have to people who are on the ground doing research. Knock on the door, book an appointment, come and say hi. I'm not a scary person at all, and I'm sure my colleagues are not. Just come and say hi. Let people know you're interested in doing research. That's how we find out about who we can hire as, research assistants. If you can't get a job as a research assistant, volunteer some time. The thing is to get exposed and get as close to research as you can. I think a lot of us don't have a lot of opportunities. And sometimes we're not the students that get tapped on the shoulder like, oh, I think you're great, come and work in my lab. I think it's important that you push yourself forward and try and create relationships and mentoring relationships as well. I think also you can create your own opportunities. I was approached by a group of students who wanted to do research and they needed an academic supervisor, but they had the idea. It wasn't me saying, let me go and find some students. They came and found me. and asked me to supervise a research project where they were going to talk to their peers about being youth and their experiences with COVID. It was absolutely brilliant. All I did was guide them to like, okay, well, let's develop the research question. This is how you're going to collect the data. This is how you apply for ethics. And it was a wonderful, wonderful experience for me. And they got information that I think I personally wouldn't have been able to get about really looking at what a youth experience was during COVID. So, sometimes you create your own ideas. You know what your life is like and your peers' experiences. There's not a lot of research looking at racialized youth, Black youth, Indigenous youth, and their experiences of the world. So, come up with your own idea and approach a professor and ask them to supervise you. You have to be just very bold and courageous. And if you knock on a door and someone says no, you're knocking on the wrong door. Go to the next one, right? Keep knocking until you get a yes. Because if you get a no, you're talking to the wrong person.
This is definitely great advice. And also this podcast, we want to serve as a route of communication and to show students that, yes, professors are willing to help. So this is amazing advice.
Yeah, so
I chose to come to UTSC specifically because it's a campus that is dedicated to addressing issues of equity and diversity, and the large student population is racialized. So you want to go places where you think you can make an impact. And, if someone seeing me is going to be inspired to go into research, then all the better. So, I'm showing up, so please knock on my door. Don't let me sit there at UTSC and be wondering where everybody is and feeling quite lonely.
yeah, hopefully our audience watching this episode, seeing how approachable you are as a professor in UFT, they will also be inspired to, approach professors that they like the work of and, start just coming up with ideas. They don't have to wait for someone to accept them. They can make their own work, I guess. And on that note, we want to end this episode with a question that we ask all of our guests. And that question is who's your favorite scientist and why? Since the name of our podcast is A Moment of Science. But I guess in your case, if you also want to talk about an activist or a researcher in your field that you admire the work that they're doing, and we would be glad to hear about them.
I am going to say my dad. My dad was a hematologist. He was a researcher. And we came to Canada in the 60s. We were the first Black family to arrive in central Newfoundland. And my dad, to make a long story short, discovered the only North American blood type, the G group. The Gregory group. It's a blood type that is very rare. I think there are probably only about 2 or 3 families in the world who have this blood type. And he discovered that from having to deal with a patient where they couldn't match. She needed a blood transfusion. They couldn't match her blood to any of the A, B, O. And through a lot of very rapid research to save her life, discovered that she had a rare blood type, the G group. So that discovery led to the only repository of G-type blood group at the Canadian Blood Services in Canada. So anybody in the world that needs that blood type has to go to Canadian Blood Services. And it's because my dad discovered this family and found people with that blood type, and they store it at Canadian Blood Services. But, he didn't get any recognition. Black scientists were very rare in Canada in the 60s. So there was no recognition for that. But my dad always taught me that you don't do this work for recognition, right? You do this work to make society and the world a better place to live in for the next generation. So that is where I get my inspiration from.
Thank you so much for sharing it. That was such a beautiful story. And saying the last part that you said, you're not doing this for recognition, that's a very inspiring quote for me personally, as someone who's also looking forward to pursuing a career in healthcare. So thank you so much for sharing that story with us.
Yeah, this is a great idea. I didn't know what a podcast would involve. So these questions are great. No one's ever asked me about who I'm inspired by. So I'm glad I got to tell that story for the first time.
It's amazing. We love to introduce new content, and it's amazing that we got your first time on our podcast too. So I think with that, Natisha, thank you so much for coming today and sharing your research and your topic of interest with us and your unique background and story with us. It was really a pleasure to talk to you. So this concludes our podcast. Thank you, everyone who has joined us today. So if you found this podcast engaging, please keep an eye out for our next episodes, and don't forget to subscribe to YouTube and follow our social media.